know better than anyone that when you implement an AI into a system, you're not just changing the AI, you're changing the entire system around it and how people integrate with it. And so it's not also just monitoring the AI performance, but also how we are performing as a system. Do you think radiographers have a role in system performance evaluation as well?
I think this would be really useful, but they have to be trained on that. Because, for instance, we, as radiographers, we don't have formal training in leadership either.
Wow, I didn't know that. Patients are coming to us and their mindset is very different today than where it was 10 years ago, you know?
Although we have the nurture into technologies and imaging, they have a unique knowledge which is called lived experience from their pathology or disease that they see and live with it every day. So I think the patient-practitioner relationships becomes much more a partnership as we speak, rather than a position of power from the clinician to the patient.
I know you run a very successful course on AI, and I'm just fascinated because AI changes so much. How do you ensure that your syllabus keeps on top of everything whilst giving everyone what they need to survive? Welcome to another episode of Rethinking Intelligence. Today on Rethinking Intelligence, I'm joined by Professor Christina Malamateniou, a Professor of Radiography at City St George's, University of London. I hope that throughout this interview, you'll get a sense about where the profession is going, how we can collaborate as a team, and what the future holds for radiography, but also medical imaging and healthcare professionals more widely. Welcome, Christina, to the show.
Thank you, Susie. I'm delighted to be here with you all.
Oh, we're delighted to have you. So the first question we ask all our guests is the same question. What do you think, in your professional capacity, we should be rethinking when it comes to AI in healthcare?
That's an excellent question to start. I really think that we have not given AI enough time and space to show us its true potential. I think we're really rushing it a lot in healthcare. We're so keen to see its promises being fulfilled about improving and saving lives. And we are very keen to take screenshots of successful examples, but we don't see always the full circle of the AI implementation and integration into clinical. Furthermore, there is a lot of scare-mongering in media and social media, on TV, online, about AI use. And I fear that this creates the new Luddites, people who shun innovation, they're afraid of it. So I really think we have to do a positive campaign about AI and its benefits and persevere and work with it systematically together.
Yeah, absolutely, especially if we want to put patient safety and also staff well-being at the forefront of that. So you've raised a lot of points, but why should our audience listen to you? What do you bring to the table in terms of your professional experience?
That is a great question as well. First of all, I would like to say that we have here with us a book, and I'm the lead editor of that book. So I think it's important for them to listen to me as someone who has been thinking about AI for many years. Whether I liked it or not, when I started my PhD exactly 23 years ago, I was working with AI to help with neonatal and fetal motion correction in MRI. So I worked with it in a way that it was more experiential at the beginning rather than theoretical. So my journey into AI was kind of unconventional. I didn't get the principles first. I got the practice of AI first with all its intricacies and the time it takes to acquire data and reconstruct with AI. And then I learned the principles and then I wrote about it. It's kind of the opposite way of learning about AI. So I think people can listen to me as an educator in AI, as a researcher for the last 23, 25 years in AI, and as a person who really cares about responsible AI.
Wow, what a journey you've been on and such a wealth of experience to bring. So this book, AI for Radiographers, is specific to one part of our healthcare workforce, radiographers, and you yourself trained as a radiographer back in the day. What kind of opportunities do you think there are for radiographers in the workforce and when it comes to AI deployment specifically?
So there are many opportunities for radiographers and for everyone working in that medical imaging and oncology ecosystems. And this includes radiologists, medical physicists, data scientists, implementation scientists, all of these new names we're going to be hearing much more about, like behavioral science and all of that. So for radiographers in particular, I think it's a huge opportunity because by nature, where we are placed on the interface between technology and the patient, because we are accustomed by this professional identity lying across disciplines, we can be bridges and translators for AI between patients and practitioners, between or across people who refer patients to us, like the referring consultants, and work harmoniously in our discipline with other professionals like radiologists, for instance. So I think we are at a key place because we are very close by nature and nurture to the patient. So there is a huge opportunity there. Whether this opportunity is going to materialize or not, it really relies on us and our professional bodies, our higher educational institutions, and the personal efforts and time investment on learning and working with AI.
Absolutely. And you've done so much work in educating radiographers, running courses, doing workshops, as well as doing research, interviewing quite a lot of them and hearing their thoughts. Could you share with us, whilst these opportunities do exist for radiographers, do they see it? How do they feel about it? I know from your work, some people are empowered, but some are threatened. Can you tell us why or how they are?
Absolutely, Susie. It's quite a mixed field. There are some people who are enthused by AI and they can see the true potential in creating a more efficient and effective healthcare service for them and the patients as well, yes, because it's also patient benefit, but also staff well-being that we can assure with AI. I would like to say there is a big number of professionals in radiography that worry about AI because of this scare-mongering and constant bombardment with phrases like AI is going to take our jobs away, AI is going to be the end of the world as we know it. And there is also skepticism, in policymakers about how we can make AI work for the future of the workforce as well, not just for the benefits, the real benefits that it can bring upon healthcare and other domains, but also how it can really work for the workforce, how we can ensure highly educated people like radiographers can continue to contribute to the workforce for societal well-being.
Absolutely. And in your various interviews and discussions, I know there's a mixed bag of opportunities and attitudes, but do you see a trend between what the younger radiographers think versus older, or maybe ones in the UK being very different to the wider European radiographers? Are there differences there, or are we all part of the same feeling?
I see that there is a lot of diffused, information and picture around the world. I know that the UK is one of the countries where radiography is really appreciated, and there are many opportunities for advanced practice and career progression. And that's why I came to this country in the first place. So I wouldn't say necessarily the people who are more informed about AI are in the UK, because the information you get depends on you. Information is out there, it's for you to seek. Of course, the language is English and it's more accessible to radiographers in the UK. And the professional bodies do a lot of work, like the College of Radiographers is doing a lot of work. They have funded special calls for radiographers and AI. And part of these calls were the reason why I was able to do all of this research in the first place. There have been the European Federation of Radiographer Societies. They have done a lot of work around raising awareness. Societies are running webinars for AI. And of course, the reason I had so much talent to work with me on this AI textbook was because of these campaigns and these research grants and applications for AI. I wouldn't say, though, it's a geographical thing. So I think there are brilliant radiographers, not just in the UK, in other countries in Europe and the world, who really innovate with AI. Some of them become entrepreneurs. Some of them lead teams with AI, lead entrepreneurial, efforts, and also they lead academic teams as well through research groups. So I wouldn't say it's only in the UK. When it comes to young and older people, I wouldn't say there is a trend. I have seen both things. I have seen the new generation, which is really tech savvy, feeling so confident about AI because they have used technology much more. But equally, because it's going to affect their careers more, they're also a bit more reserved. Say, I really want to see that this is going to work for me. And the new generation is much more proactive when it comes to their own well-being and say, I really want to see that working for me before anything else. I have found there is a mixed bag of opinions which are shaped by your local context, whether how you work, how you use it, how AI has been presented to you. And the role of training and education is huge here.
Absolutely. And you touched upon something about leadership opportunities and how some radiographers are leading research teams like yourself and some are leading AI deployments. Do you think that those opportunities are well established? Do you think there's enough opportunities for radiographers to see that that is a role that they could take? Or do you think it's very much down to the individual to carve that for themselves?
Absolutely. And I think this is not just for radiographers, it's also for radiologists and other professionals. We have what we call the AI champions. And although in the UK and other countries, we try to carve out these roles, they're not yet established. They are developing and they can be called digital transformation leads. There are all these fancy words to say basically an AI champion or an AI ambassador. But it's down to the individual. It takes a lot of effort, personal development, participating in training, keeping in touch with the conferences and the textbooks and all of this online material, which is massive to digest and assimilate. And of course, it's to put the effort and the hours for that. When you do implementation, you know that better than anyone, Susie. There's a lot of effort to try and coordinate with teams, understand what is needed, what is the clinical challenge, where are we heading to, what are the risks, speak with governance teams, cost, all of that. So it takes a huge amount of personal effort. And that's why I feel that the future leaders in AI are not going to be determined by a professional background. It's by those who really invest time and put the effort into that. So whether this is a radiographer or a radiologist, I wouldn't be able to tell unless I see them putting effort into that, getting educated, and putting the hours required behind that.
Yeah, I think you touched something spot on. There was a recent panel discussion with a few different AI leads from the NHS and asking them how they got their role. And all of them had a very different pathway. There wasn't like I did this degree or I got this qualification and then applied for this job. It was, I wanted to implement an AI. I spoke to people. They then thought I was the best person for the job, or people saying someone else just nominated me. So you're right. The pathway isn't very structured. Do you see it being structured in the future, or can you ever see it being always a bit muddled as technology is so variable?
What we experience is quite remarkable and exciting. At the same time, it relies a lot on individual input. So I think if we are serious about AI, we have to standardize career pathways for AI leads. We haven't done that fully yet, so it's a bit like haphazard. Who takes the opportunity, who has the skills, who puts in the hours and the time. But I think if we're serious about AI implementation, for it to materialize in real graspable benefits for healthcare, for patients and staff and students in healthcare, we really have to carve out these career pathways for everyone. There has to be clear knowledge, skills and competencies, outlines and frameworks for people who want to go into that field, and appropriate training, which might be embedded in the current training. This takes time, though. We're saying that we're discussing, but this is probably 5 years down the line because we're still trying to make sense of what AI means. At the EFRS, the European Federation of Radiography Societies, I am currently the chair of the Imaging Informatics Group, and we are trying to do a Europe-wide study around the required knowledge, skills, and competencies for radiographers who are going to lead in AI. It takes a huge amount of time. There are a lot of methodologies one can use. We're currently using Delphi as a method with experts who have actually used AI. And we're trying to create a map for Europe. This map is going to be an early map because this is going to change over the years. But it's nice to have something to build on than nothing.
Absolutely, because it sounds like when we talk about AI leadership, and speaking to your point about what we have to rethink in medicine and with AI, there's a lot of things that can go wrong. And if you're now being told you're going to be the lead, it feels like a lot of responsibility with very little guidance as to what you need to know and what you should be aware of. And there's a lot of unknown unknowns, which I think even if you have a brilliant person, they may not put themselves forwards because of that uncertainty, which we inherently dislike as a specialty.
You are so right. Because in healthcare, there's this accountability and there's also the need to do no harm. So without guardrails, people are not empowered and encouraged to be part of that AI revolution, because they say, what if this is not going to work the way we hope? I don't want to do any harm, and I don't have the right training yet, so I'm going to wait. And this impedes AI implementation for sure.
One thing that I'm quite concerned about when it comes to leadership, but also in terms of project management and implementation, is this concept of asymmetric burden within a system. You'll have people who are really good at bringing things into a system, like maybe an AI lead who's like, I led the digital transformation, but those skill sets may not necessarily be the same skills as keeping the system running and troubleshooting and making sure feedback is taken on board and things are changed. And that may also be very different set of skills and personality types who need to do that. Do we have different people to do that? I also feel like the burden of keeping things going may be sometimes quite treacherous and drudgerous compared to, say, the exciting part of bringing something new. And sometimes the bringing in something new gets more of the elite glory, whereas the person who's doing the donkey work and sustaining things gets a little less attention and may have a slightly less attractive job. And so there's all this asymmetry I see in a system, and I don't know how we resolve that or what you think about that.
First of all, we are not there yet, because the way AI infiltrates, permeates our clinical lives has not reached the stage where we can say, someone is going to do that, someone else, something else. I think it's more like an exploration at the moment. However, I do think that there will be people who are going to be leading and innovating and becoming the entrepreneurs, the developers, and the ones who are leading implementation. But there will be the others who are going to do the very important task of control and governance and quality assurance. So radiographers traditionally were doing audits for clinical services. And there is a word that, it's not clearly quite like an audit, but the post-market surveillance is going to need a lot of important auditing skills about assessing the performance of AI over time. So here we're really well placed to do that task. It's complex. It needs input from other people as well. But the day in, day out, we'll need people who are dedicated, close to the patients and the equipment and the AI tool. And they will be acquiring what we can say like an intuition about the tool. So this has worked, it hasn't worked. One thing I would like to say about intuition, professional intuition, everyone knows their professional intuition. When I was working clinically, because now I don't work anymore clinically, I work mostly in academia, I knew the morning I was switching my scanner on or my PC on, whether my scanner was okay or whether my scanner was sick, from the sound of it, from the time it took for my software to load onto the screen. So that's the kind of professional intuition that you need to have for like a proper quality management system in AI. And this is going to be so important, because we know that if you take a snapshot of the performance of AI over a year, this is not the true performance of AI. And we need to keep monitoring for quality and safety. And these are all important jobs that can be done by different people. I think radiographers are going to be very good on the quality assurance and quality control of AI. And this is a key role that someone can take on in the future.
I also think, lots of places are going to be implementing possibly similar AI tools, and one hospital may see a bug in the system sooner than the other, and we really need to have good collaboration so that we can get on top of these things much faster than waiting for these errors to happen in your particular institute. Sometimes these errors might happen only one every 10,000 or 20,000, and it might not have happened to you yet, but you still need to be aware of it, right? So having that communication is crucial, which is why I think societies with different memberships across different countries play such a critical role in communicating the downstream effects. And the second thing is, you know better than anyone that when you implement an AI into a system, you're not just changing the AI, you're changing the entire system around it and how people integrate with it. And so it's not also just monitoring the AI performance, but also how we are performing as a system. Do you think radiographers have a role in system performance evaluation as well?
I think this would be really useful, but they have to be trained on that. Because, for instance, we as radiographers, we don't have formal training in leadership either.
Wow, I didn't know that.
I know, because I have guest edited a special issue on leadership. and across the world by one of the journals I'm an associate editor with. And I saw that in North America, our radiographers there have the language and the theory of leadership because they have well-established courses for leadership for many healthcare professionals, including radiographers. Whereas in continental Europe and in Europe in general, we don't have that. There are very few courses that start now in the UK, which are brilliant, but we have to build that culture. We have to create that culture of, if you're going to have leaders, they have to be properly trained. And the best leaders, the most credible leaders, are clinical experts. Those who have done it, they have seen it happening, and then they can get trained into how to lead properly. For some people, they're talented, they really can manage a team, but you need to have the theoretical underpinnings and know about methods and systems, for instance, how to manage that. And it's quite a complex case, to leave it to someone's talent only.
Oh, absolutely. Why do you think there isn't that leadership training? Is that historical or just radiographers not being seen as leaders? What do you think is that?
I think many radiographers lead, but I think we are a new profession. We are not around for many years. So it's part of the normal development of a profession to continue to do that. Now there is there are more studies around leadership, led by people in NHS England, by one of my colleagues. I don't know if I'm allowed to say names, but I'm happy to say Carrie Mills, who is doing fantastic work with leadership, and she's examining the ins and outs of leadership for radiographers. I'm also very fortunate to supervise Gemma Walsh's project, which is funded by UKRI, on AI leadership for radiographers. And how are radiographers going to lead? What do they need to lead? What career pathways in leadership can we forge for them? So there is a lot of epistemic discussion around leadership for radiography. This is not new, but the need to formalize leadership training is actually more relevant now than ever before.
I completely agree. For radiographers and for other allied healthcare professionals and doctors as well. Taking a little bit of a pivot now from leadership and education to more education, I know you run a very successful course on AI every year at City St. George's University, and I'm just fascinated because AI changes so much. How do you ensure that your syllabus keeps on top of everything? Because you've just mentioned lack of leadership training, and now we're going to put that in. We know this year or last year, sustainability, green AI was very important, and you have to put that in. And so how do you do that without making the course from 1 week to then 6 months to 2 years, whilst giving everyone what they need to survive?
I have to say that this course feels like an annual conference at City St. George's University of London, and initially was addressed only at radiographers, but we realized there are a lot of synergies, so we opened it up to anyone in the medical imaging and radiotherapy ecosystem who works within this ecosystem. So every year I update the course about 50%.
Wow.
So at the beginning it was more about getting it right and seeing. So now it has run for 7 years. It's going to be the 8th year next year in November. Then it was more about getting the teams together. Then it was about AI implementation. Then it was about sustainability. Then it was about human and AI interaction. So every year, because I'm fortunate by the professional bodies I work with, by the people I work with, by the grants we acquire, to be able to travel and go to conferences, they're essential for getting the vibe and the knowledge you need for AI, because knowledge travels faster than a paper. It's so important to be able to speak with the people who do it. I see the trends and I see the people, and I'm trying to recruit the best. They're all handpicked. You are all handpicked to come and teach to the course, and I'm really grateful that you are one of our really celebrated. So it's quite a big effort, and also bringing the people together. And now what I'm doing over the last 3 years is I'm trying to make it in a way that makes also sense, because getting all these experts is 30 teaching hours. Getting all these experts at the same week and in a way that makes sense pedagogically, it's quite a big work. And it starts the day after the course finishes. So it takes about a year to get it right.
Wow. Well, congratulations on getting that together. And I don't want to put you on the spot, but you've done this now for 7-8 years and you've seen the transitions. Would you like to make a prediction as to what next year or the year after might bring? Is there a pattern that you're seeing develop, or is it totally random what the next thing is going to be?
I cannot predict because there are things happening all the time. Like, we have the agents and the foundation models, and technology goes faster than we can blink, really. You turn your back and then there are 100 publications on something you have heard for the first time yesterday. What I want to say, though, what is really important for us to navigate this space as professionals, and this is not just for radiographers, it's for everyone, is to build digital resilience. So basically, be ready to assimilate and understand and have the tools, these transferable skills to understand what does this address? Is it a useful technology? How does it work? And how can we use it to maximize benefits and minimize risks? I think this has to become like an automatic thing for healthcare professionals, to be able to be digitally resilient and flexible with that, because things will be thrown at us in clinical, in education, and we have to be able to appraise them quickly and put them in practice if they're useful, or say, this is not ready yet. I think we need to have this, and that. So I think this is a skill, I would say, is a skill for life at the time we live now because of the fast technological innovation that we experience. And there will be a time when the Gartner cycle is going to reach a plateau, hopefully not too long from now, and then we can actually make real work.
Absolutely. And I think that's really important point about being adaptive to what we want to create and what problems we're solving. The problems our patients are coming to us and their mindset is very different today than where it was 10 years ago. We now have patients using ChatGPT to interpret their radiology reports, coming maybe with particular preconceived ideas of what the imaging test might involve and what it's going to show. Some are more educated, some are less. I feel like the variety of patients we see now is actually growing more wide because you've got the people who are digitally excluded versus those who are very, very savvy and vibe coding their own apps to explain their healthcare to them. And so it's hard to kind of accommodate everyone, I think. I don't know if you feel that or if you...
I think there is a huge responsibility for us, more so than what was like 40 or 30 years ago, to be knowledgeable about the new technologies, because the patient will not come with questions about what is that. They will come with specific questions about how can we use AI for that, or I'm worried about that for my care. And although we have the nurture into technologies and imaging, they have a unique knowledge, which is called lived experience from their pathology or disease that they see and live with it every day. So I think the patient-practitioner relationships becomes much more a partnership as we speak, rather than a position of power from the clinician to the patient. I really think that this is how we need to be training our clinical practitioners for the future, to be ready to work with a patient, obviously with their clinical expertise, but to work and to listen. And perhaps AI, this is the hope, isn't it? That AI is going to take away all of these time-consuming reporting and documentation that clinicians are currently doing, and leave time to care.
One thing that I'm quite excited about with the promise of AI, let's see if it's too hyped up or not, but that I know you care about a lot, is about working with patients and staff who are neurodivergent, and the fact that AI promises to be adaptive and can alter according to how you interpret information or read things, or in a way that makes it more understandable to you, and it can be so intuitive that, just with a click of a button, based on everything it knows about you, it'll present something to you that makes sense rather than everyone having to adapt to a standardized way. Is that realistic? Is that dangerous if everyone has slightly different outputs, or is that a good thing, do you think?
I would say that new technology has always two sides, everything, and AI is not different to that. So when it comes to the intersection between neurodivergent patients and technology, I think for some of them, it will be an amazing tool that is going to increase accessibility to healthcare, which is part of what we do at our research group called CRAG, to try to increase accessibility, because neurodivergent people have been systemically and chronically traumatized by negative healthcare experiences where they have not been included. People have not had proper training until very recently about how to work and collaborate with a neurodivergent patient in clinical practice. Because of all of these things, we have to be very careful about the impact of AI on mental health for neurodivergent people, for all people, but for neurodivergent people more important, because they might experience a period of excitement about new technology, but without proper support and advice, this technology can be used suboptimally. And I speak about us as professionals, but also by patients who are neurodivergent. So we have to ensure that we celebrate and we signpost the optimal uses of AI, and at the same time we forewarn people about the potential risks of improper or unsolicited use of AI in any way, because AI, it is what we make it to be. We make it to be used for a good reason, and it's going to yield amazing outcomes, like predicting the occurrence of breast cancer 5 years before. And if we can do that for all cancers, this is going to be a cancer-free society. This is going to be amazing. I say that and I feel goosebumps. It's going to save so many lives. At the same time, because it has a huge reach and scale, it can be scaled up very quickly. If it does, causes harm to some patients, it will cause it en masse. It will be a massive problem for many, many people. And we do see now these discussions around chatbots that use AI and mental health and can be used as digital friends. And I'm not sure these chatbots are trained at all on how to speak and communicate to any individual, more so to a neurodivergent individual who might have different preferences in communication and might perceive the world in a different way.
That can be so different from person to person. There isn't like one correct way to speak to a neurodivergent individual, is there? But we've also seen things emerge about using AI to teach you how to communicate and to teach you empathy. I don't know whether that's good or bad. I know that we have a workforce shortage, and that includes teaching people and educating people. But getting an AI to teach you very humanistic skills, is that proper or appropriate?
I don't know. This is a thing I'm thinking every day about empathy and AI.
Yes.
I'm not quite sure. I mean, there are cases where, they have done some studies. I'm sure you have seen those studies, Susie, about using AI to make a response a bit more emotionally attuned to the person. I'm not sure if you are a healthcare professional, if you actually need that intervention in your building empathetic or empathy skills, or whether you need another intervention about preparing with role play and case studies and scenario based than having ChatGPT tell you how to be empathetic. I'm not sure. I have not decided on that topic yet. It's quite active. So I'm still reading about it and assessing and seeing what the literature says, case studies. I think it's quite early days to allow or to enable AI to help us build empathy. So perhaps in a few years we can have this discussion again. I think it's quite early for me to decide what is right or wrong on that.
Yeah, absolutely. So we've covered quite a lot already. And for the last bit of this interview, I want to talk to you about another emerging topic, which is very close to both of our hearts, and that is changing professional identities. What does it mean to be a healthcare professional in the next 10, 20, 30, 40 years? You touched a bit about education, leadership, professional intuition, and these are all kinds of things that feed into who we believe we are and what value we have. And I think one big thing that's worrying a lot of us right now is this concept of automation bias and de-skilling, and whether what we hold dear and what we've trained so hard to build in our repertoire is being taken away from us by AI. What are your thoughts on that? Do you believe in that? Do you think it's inevitable? Or do you think actually it doesn't have to happen if we prepare correctly for it?
Our professional identities are core. These are our values, why we are in healthcare. And I've done I was teaching leadership, and I was doing a survey around what are your values. And the values overwhelmingly over the years were helping others, loyalty, honesty, all of these positive values that they are society enhancing. So we have a very strong moral compass as healthcare professionals, all of us, not just radiographers. So I think this is the core, and this is where professional identity lies. At the same time, we have to keep on updating our skills, might be technical or clinical skills, or the intersection of these skills. And I think the most important, as I said earlier, is in this reskilling. I'm not going to call it de-skilling, reskilling. We need to demonstrate digital resilience. I don't think it is necessary, unless someone really likes it, to learn to code. Because people ask me, do I have to code? Do I need to know how to code? I don't think, because AI can even do that now. We know that. We really need to understand how to apply AI in practice, what are the real dangers, and how can we maintain this strong moral compass for healthcare, which is about serving other humans and serving other patients and also supporting each other, because you cannot pour from an empty cup. We need to ensure our workforce's well-being is at the heart of healthcare in the future. We cannot let that drop. So I really think that there might be many different skills one needs to know. Obviously, technology is emerging, governance is changing across countries as well. So I really think that digital resilience and a strong moral compass will guide us safely through what seems to be a transitional period.
I couldn't agree more. But there is one thing about it that scares me quite a lot, and it's about our ability to be self-aware of our own skills and where our limits lie and where we believe in our strengths and where we feel is safe to outsource to a machine. There's been quite a few things in the literature I'm sure you've read about how, when a machine tells you an answer, people are more likely to believe in the machine even if they don't fully trust it, because it's a machine. It's been trained on so many more thousands of case points than I have, even though I have this, as you talked about before, this professional intuition that, hey, it doesn't sound right, things seem a bit odd, but oh well, maybe it's just me, maybe I'm having a bad day, let's just override it and go with the machine. But it has to be a good balance or a calibration between the two, and one thing we're not very good at is knowing when we're not doing well. And I worry how we build that so that we can trust in the right way.
I think there are two ways, because what you have very nicely explained is about this human-AI interaction, which is a key area of your work and of the work of others currently in that space. So I think we have to do it in two ways. First of all, self-awareness of our own limitations as individuals, as clinicians, as practitioners, as academics, educators, but also very importantly, teaching about the many ways AI can fail as well, because this is a two-way thing, it's a human and AI. And we've done amazing work together, Susie, with other people from that space on trying to summarize the potential errors of AI from the literature. And what we found out is, first of all, there are many different errors from the AI tools and AI models themselves, from infrastructure, but also from the human factors. And what I think is really important is to teach these errors as part of the education and training of AI, and also change our mindset to stop being afraid of mistakes. It's difficult to do that in healthcare when mistake comes with accountability. I acknowledge that. But teach and learn from mistakes as a way of growing. So imagine if everyone who has used AI and they have found out that AI does not work for their context, for their practice, for their specific, demographics and scanners and stuff, if there was a depository where they could submit the data safely, anonymized, with all governance maintained, for others to use the data and learn from that. I'm sure this would be a big depository because of publication bias. People don't want to publish these results, but it would change our mindset in healthcare towards learning and growing from mistakes. This is standard practice in engineering. So they do all of these tests and they learn from mistakes in healthcare because of the potential impact on human life and health. There is a lot more awareness around that, and we really try to shy away from our mistakes. But there's so much learning into that. So I really think that acknowledging our limitations as humans, but at the same time realizing that AI is not panacea, it's not going to solve all the problems. So we can kind of work together in a way to minimize each other's weaknesses and work together as a system. This is going to be where AI is going to maximize its value, I really think.
Oh, amazing. I couldn't agree more. So we're coming to the end of the interview now. Is there anything that I haven't asked you that you would really like to share with our audience that we haven't covered yet?
I would like to speak a bit about how gendered AI can be in healthcare. I think this is a very big thing because I feel that we need to do more about that. I don't know if any young girls are going to be listening to that podcast, but if they do, and women in healthcare, I want to say that we make up 50% of the population. We should have the same space at the decision-making table. In the boardroom, the data for any AI model should be equally trained for men and women to stop this constant under-recognition, under-diagnosis of female-related pathologies, or for common pathologies amongst the men and the women to give equal opportunities to everyone to have good healthcare from diagnosis to treatment across the patient journey. And also I want to see, currently the representation in AI healthcare of women is only 25% in leadership positions. This is too low, and this is also too dangerous. You see the papers out there, you see the presentations, you see the panels, and we need to see more women, not as a tokenistic thing. Women have so many things to offer in AI, from a responsible AI perspective, from a governance perspective, from innovation, from leadership. So I really hope that in the coming years, the mistakes we have done in medicine so far, and we will give women the place they deserve in the AI ecosystem. And I really worry if this doesn't happen, AI will always be imperfect and potentially dangerous.
Thank you. Those are really powerful words to end on. What would you like our audience to do as a result of everything we've discussed today? Do you have a call to action or anywhere they can go to find out more information from you, or any messages you want a hospital executive listening in to do? The floor is yours.
So I would say I have seen from my work that we need to be more serious about education on AI. So this is the first step. And this can be done by and moderated by professional bodies, by healthcare institutions and higher education institutions. And I think this is the first step. I know there are a lot of efforts and contemplation around AI governance. And I want to assure people who are policymakers that AI governance is not going to stifle innovation, but it's going to make innovation fly, because people will know what are the limits, what are the rules, and what are the guardrails. So once they know, they can actually innovate. The uncertainty is having exactly the opposite effect. So I would say education and governance and start to build the digital skills that we need for the future. This might be far and foremost than anything else is digital resilience, because in the next few years, it's going to be, a quick ride. So we have to be ready for that.
Absolutely. Well, thank you so much, Christina. Really enjoyed this conversation.
Thank you, Susie. It was lovely for me too.
And that concludes another episode of Rethinking Intelligence.